Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us leading prosthodontist and dental surgeon, Dr. Rajeev Narvekar. Dr. Narvekar is here today. He will answer your questions on dental implants and why senior citizens should visit their dentist at least once in 6 months. A little about Dr. Narvekar. Dr. Narvekar, as I mentioned, is a leading prosthodontist and a dental surgeon with a basic dental degree in India and specialty training in Philadelphia, USA. He is head of the Center for Advanced Dentistry at the Breach Candy Hospital in Mumbai. Dr. Narvekar's private practice is limited to rehabilitation of oral and maxillofacial defects. Intra-oral treatment includes replacement of a single tooth to full mouth reconstructions conventionally and with implants. Welcome to Health Live, Dr. Narvekar. Delighted to have you here.
Thank you, Mr. Maheshwari. Thanks for having me, and thank you for the introduction.
How's it been for you? We've now into the end of the year and 10 to 11 months with the COVID scare. Tell us a little about dental care in this period, because going to a dentist means the patient and the doctor have to be up close, and with the threat of the aerosol, etc., which are there. What is it?
Basically, we've been working since June now, and we have some protocols in place. Initially, of course, everybody was sort of groping in the dark, trying to figure out what needed to be done. But now we more or less have everything sorted out, we think. Of course, everything is so far so good, but by the same token. So what we have done now is we have 2 or 3 things in place. Besides the regular aerosols, you have to realize are generated by all our instrumentation that we use. It's spread by droplets, of course, the initial COVID as they talked about. And now we have added to that, we have the ultrasonic instruments, we have our air drills, and that aerosol spreads not only within the room, but also on all the surfaces that we have in the room with us. So to do that, what we need to turn on and do is we have done 3 things. One is you have what they call a large extra-oral suction, which sucks out all the aerosols, besides the actual suction which suctions in your mouth. We have HEPA filters, which takes care of the remaining filters. And now we have something called Corona Guard, which is an electronic, it sets out electrons. And these electrons basically destroy the S protein and prevents the host from attaching to the human cells. And that prevents COVID to a large extent. We've got all these things in place. So we are hoping that everything works out. We've been seeing a number of patients now for a variety of things. Of course, we always suggest that it be emergency treatment and not necessarily elective treatment.
And what would you advise would be the protocol that a patient needs to look at? For instance, in the case of dental care, you can't really have telemedicine, right? You need to check and figure if there's a pain in the tooth, then the only thing that one can do is come to a dentist.
Without a doubt, we do what they call triage, which is basically like telemedicine. We have teledentistry. You try and do the best you can with antibiotics and painkillers. And if that doesn't work, of course, the patient has to come to the dentist. They don't have an alternative. So what we do is the first thing that we do, and which is really critical, is the contacts. You need to establish the contact of where the patient's been for the last few weeks and days, whether the staff, whether the drivers, whether anybody else has been out. Make a decision whether you need to get them into the clinic, and if so, they have to turn on and report to the clinic what they have done. Once they're in the clinic, then of course we have all our protocols in place, which includes the gun, your infrared gun. We use your sanitizer, your mask, your foot covers. Everything's done exactly like a sterile theater, and we treat the patients accordingly.
Doctor, we've got quite a few questions that have come in because when we made the announcement, and those of you who have questions for Dr. Narvekar, please put them in the Q&A tab. And I would request you to also mention your age and your gender, if that helps in Doctor addressing the questions. So I'll start with a question from Jawahar Goradia, who says, I'm 74, and of the 32, 1 dard is removed. 2 more, 1 wisdom tooth and 1 nearby, are cracked and broken, but not sensitive, and I am able to use them. My question is, should I remove these 2 teeth?
If the dentist that you're going to is comfortable seeing you and doing whatever is necessary, maybe take a couple of x-rays, that's fine. But if you're not comfortable getting to the dentist, my suggestion is live with it for another couple of months and hopefully things will improve. Of course, as you know, the vaccines are now more or less seem to be close to where we are, but that will take a while before all of us get vaccinated. So, I mean, unless it's an emergency, I would suggest you may just want to wait it out.
Thank you. We have a question from Ashok Mehra. Uh, he says, I have removed the lower teeth almost 8 to 9 months back. At age 74, is it advisable to go ahead? Also advise if insurance is covered. Uh, I have problems of jaws, cannot open very much. Presently, he named a doctor whom I don't want to give the name of, has been treating for the last 20 years. Uh, what would you advise? And also advise if insurance is covered, what are the costs and do you do?
Okay, so the thing is, if you've been to a dentist for 20 years, my first suggestion would be please go back to him. You need to go back to people whom you're comfortable with. It's not a question of somebody else doing something else. But having said that, insurance, if you're talking about implants, insurance doesn't cover it. It's elective treatment. It's not something, they consider it, at this point, they're considering it more aesthetic rather than functional, which is, in my opinion, not true. But by the same token, if the mouth opening is not there, there are various ways of treating those situations. But I think your dentist have it after seeing you for 20 years, I'm quite sure would know exactly what's to be done for you. I don't think that would be a problem.
Right. Thank you.
And you're talking about elective surgeries, some implants. Do understand, when you're talking about aerosol generation, they're generated by what they call ultrasonic instruments and air motors. The instruments that we use for implants is an electric motor, and the aerosol generation is probably 1/10 of what it is with your air motors. So it's perhaps safer, and I don't think that would be an issue. I'm sure your dentist would be helping with that.
Doctor, some questions are coming on implants. So let me just raise them and then perhaps you could talk a little about that. One is Malcolm Montero asks, implant versus bridge, what is recommended and when? And Anthony Disa says, after a tooth is extracted, what's the maximum time within which the implant has to be done, as the gum does grow fast?
Okay, for the first question is, if you have a single tooth that's missing, to put a bridge, what you really need to do is you need to shape or prepare two adjacent teeth, one on either side, and put the bridge in place and cement it into place. Whereas with implants, you don't touch adjacent teeth. If you have sufficient bone that's available and it's a standard procedure, you can just place your implant without touching the adjacent teeth and have a single tooth replacement for what's missing. And that applies to even a couple of teeth missing. Of course, if there are larger spaces, you can't do that for sure. Now, where the second question is, when you talk about teeth being extracted, you need to know why the tooth was extracted in the first place. If it was an infected tooth, then you need to wait about 3 or 4 months for the bone to heal completely before you place the implant. And that 3 to 4 months is not a problem. What most people have a concern about is that the adjacent teeth tend to shift in that period, but 3 to 4 months is not a bad period to wait for. Let everything heal, take a fresh x-ray, and then go ahead and do the treatment.
Thanks. We have a question from Dimple Divecha, who says, I'm 55. How do you take care of implants? Any special cleaning?
Well, there are lots of protocols that we have in place, including the use of a water pick, which you can use for normal teeth also. But for each kind and a different kind of prosthesis, it's a question of regular and just simple maintenance. And of course, getting back to your dentist every 6-8 months for a checkup, just to make sure everything is fine. Otherwise, the protocols are the same as you brushing your teeth. That's it.
Right. Thank you. We have a question from Colonel B.G. Duggal. Colonel B.G. Duggal retired. He says, I'm 78 years old. I'm a male. I lost 10 upper dentures during the lockdown. I want to replace them. I have consulted the local dentist. Line of treatment suggested is extraction of 2 or 3 teeth per week, rest for about a week, and then denture work to start. But they have recommended to wait till the vaccine is out. I'm eating semi-solid food. I'm taking adequate care. No pain so far. What do you advise?
If the patient has no comorbidities at all, I mean, and if the denture and the patient and your dentist has all the protocols in place, you can certainly get the teeth removed and have the dentures made for you, especially if you can't eat, because this may go on for a while. And before all of us are vaccinated, whether it's the dentist himself, the patients and everybody else, it's going to take anywhere between 6 months to a year. It's all very nice to say the vaccine's around the corner. The vaccine should be first done. Vaccine should be available to everybody. And then the hospital should be in a position to give that and administer that vaccine. That will take a year for sure. So as long as you can function for a year, then it's not a problem. You can certainly wait.
We have a question from Subhash Singhal, who says, I'm 77 years old, a male, vegetarian, non-smoker, no hard drinks. I don't have any bridges. For the last 2 months, I'm feeling weak, lower front tooth, and oversensitive teeth. I'm scared to go to my dental surgeon. Please suggest some remedy.
Okay. Talking about sensitive teeth, the number of patients that we have seen staying at home, people have just been, this is more mental than dental. Patients are just frustrated, and the number of patients that we are seeing who are clenching and have come with broken teeth, chipped teeth, snap teeth, a variety of things, old bridge work which is broken. We're seeing so many of them, and we're seeing them on a weekly basis, and that's only because patients are sitting at home. So if there's trouble, and if you're completely confident that your dentist has all the protocols in place and there's a problem, I would suggest you go and see him and do whatever is necessary.
Right. We have a question from HS Padam, who says, I'm 68 years old and have had 2 lower jaw implants. Now want to have them on the upper jaw. What should be the minimum thickness of the jaw? My upper jaw is 13 mm thick.
Oh, if you have 13 millimeters, you have fairly good amount of bone to place implants. There's not a problem at all. If it's in the anterior region or the posterior, if it's in the posterior region especially, you have really good bone available. There's not a problem. You can certainly get implants.
There is a question from an anonymous attendee who says that I have diabetes as well as blood pressure. The last time I heard from my dentist, she recommended that I will need to check my diabetes before getting the implant done. What is the theory behind this?
Oh, it's plain and simple. It's a question of healing more than anything else. Insulin is a great healer. So what you need to do is, if you have diabetes, things don't heal very well. And if you place the implant and you have a crown on it and food collects, you tend to lose bone around those implants much faster than a person who doesn't have diabetes. So what your dentist is suggesting is absolutely correct. You need to go to your family physician, make sure you're completely covered, make sure he agrees that your treatment can be done, and then go ahead and get the treatment done.
There is this question that has come in post your response about the bridge versus the implant. Doctor, can you please advise when is the need for an implant? I have got root canal surgeries done for my teeth and most of them have been successful. But do I need to get implants done for teeth that are really in bad shape?
Yeah. So the thing is, if the teeth have been root canal, see, the main thing when I mentioned was talking about the replacement of a single tooth using an implant, as opposed to cutting down 2 adjacent teeth, one on either side. Here, if the root canals have already been done for the teeth, you can certainly you have to cap them. So if you're going to cap them, then you might as well do your bridge work as opposed to doing implants. Absolutely. If the teeth have been root canaled and they're not in good condition, then and they have to be extracted, then you may want to look at the option of implants. But that really would depend on your X-ray and depending on the position of the teeth in relation to the spaces that are there.
Right. There is another question that has come in from, he says he is 65 years old. He is a non-vegetarian. He is a smoker and he has his drinks. I would like to know how I can take care of my teeth in a better way without really giving up on my vices.
Okay, so 2 things. One is, it depends on the amount of alcohol and the amount of cigarettes. That's the first part of it. The second part of it is, a visit to the dentist every 6 months wouldn't help to make sure that you have, the oral hygienes maintained well. As long as you do that and you have basically good gum condition, there is no need to, you can certainly continue with your smoking, but smoking, as you know, has other issues with your lungs and things, which you probably want to stop because of that more than your teeth. So that's my advice anyway. So.
Thank you. We have a question which has come from Sheila Kohli. Once a tooth is extracted, do you wait for 3 months to place an implant and then another 3 to place a crown? Some dentists extract and immediately place the implant. So I'm not clear on that.
Okay, this works on a case-by-case basis. As I mentioned earlier, sometimes you may have a situation where the tooth is completely infected. You need for that bone to heal before you place the implant. Now, from the point of view of putting the tooth immediately after, there's a concept called immediate load, where if when you place the implant, you have sufficient torque or strength in that implant, you can actually place a tooth on it nearly immediately. Otherwise, you wait for the 3 months. But from the time schedule that has been given, it's obvious that the bone is probably infected with the tooth. It needs to heal. Then you place your implant. You wait for the 3 months of healing, and then you go ahead and place the crown. That's standard protocol.
We have two questions which have come, which are similar. Uh, One is from an anonymous attendee. He says, I'm asking for a 77-year-old who has to undergo transplant for upper set of teeth. Is that recommended over dentures? If yes, what precaution one needs to take? Also, does the jaw shrink if dentures are used, and therefore dentures need to be replaced regularly?
Yeah. So when you place a denture in the mouth, it sits on the gum basically, and over a period of number of years, you always have bone resorption, which means you basically have bone loss. With the implants, and also the question comes about is the amount of the kind of food that you can eat with a denture, as opposed to having something like which simulates your natural teeth. So if you have implants or 6 implants or 8 implants in your upper jaw, and you have a fixed bridge there, you can eat a lot more than what you can eat with dentures. So if there's very little comparison from the point of view of what you can do with the denture is what you can do with having implants in the mouth.
The other question on dentures is, Doctor, do you recommend dentures at all for falling teeth? Because I've heard stories where dentures are not recommended because of various other issues that come in because there is a foreign body that is coming into the mouth.
Okay, so people historically, people before implants were sort of became the fashion, people wore dentures. So I don't think that's really an issue about wearing dentures. Now, if he's talking about, or the gentleman's talking about wearing a denture for a single tooth, yes, that becomes an issue, because what happens is, if it's for a single tooth and you make a denture for only that one tooth without an attachment anywhere else in the mouth, the chance of swallowing that little denture that you have in the mouth along with your food becomes, and we have seen that happen before. So it's not something that we would advise.
There's a question which has come in from somebody whose father is 84 years old. He says, still, what is the right age? What is the upper limit age for implants?
So we have placed implants for somebody who's 92 years old. What you really need to do is you need to find somebody who's healthy completely, certified by his family physician, and number two, has sufficient bone available to get the treatment done. Those are the two criteria, and that's about all, really. Age is not an issue. If the patient's walking around and can function normally, there's no problem from getting implants.
The other part of the question is it really safe for a person who's that old? But I guess your earlier example of a 90 plus person is enough of an example reason for that.
It's as I said again, it's as long as is physically fit and is medically fit to get the treatment done. I don't think there's an issue getting treatment done. Of course, what you can do is, and what we do on a routine basis, is speak with the family physician or the physician who's looking after them and see whether they can undergo the procedure. If it's a single implant, it's a really quick procedure. It takes us nowhere more than anywhere between 3 to 5 minutes to place an implant, or maybe 10 minutes at best, if at all. If it's even a full jaw, it doesn't take more than an hour or so to finish and get done with the treatment. So the time frames for the surgeries itself are very, very small and quick. And yes, there is some amount of trauma, there's some amount of discomfort after that. But if the patient's healthy and can withstand that for a couple of days, it's not a problem at all.
We have a question, again, since there were several questions from anonymous attendees, I don't know which one this is, but who says, thanks for the clarification. Will the 77-year-old run any risk in undergoing implants, especially during these COVID times?
No, as I mentioned, again, I get back to that. Yes, we have taken all the protocols we can, but there are people who have been at home for 7 months and have still got infected without realizing how they've got infected. So you can go to your dentist and get treated knowing full well that he's taking all the precautions that he's taking. And I'm sure all us dentists as colleagues would probably do the same for all our patients. So having said that, it's fairly safe now. As I said, where aerosol is concerned, we use electric motors for implants as opposed to air-generated motors, which the aerosol is much, much less. We have extra-oral suctions. We have a variety of things which take care of all of that for you.
Doctor, this is a question which is, you know, perhaps there uppermost in the minds of people. Says, Doctor, you are at a great hospital in Mumbai. How do I ensure that my dentist is following all the protocols that you have recommended?
Sorry, you know what, as I said, what you need to do is just pick up the phone and call the dentist, especially if you've been seeing somebody for a number of years. Somebody mentioned they've been to a dentist for 20 years. You don't want to change it at this time, and most dentists realize what's happening. They want to be safe themselves. I mean, I'm sorry, I'm not. They will make sure you're safe for your patients, you're safe for yourself, and safe for your staff in the clinic. So nobody's going to take chances today. I'd be surprised if anybody does. I'm sure most dentists have the same protocols in place, without a doubt.
Yes, I'm sure. Uh, but these are doubts that are there, and as you figured, there are so many questions which are around the same issue. We have a question from Mr. Mahesh Chaudhary. I guess it's an existential question for people who have had implants. Why is tea prohibitive for 3 months during an implant, after an implant?
What is prohibited? I'm sorry.
Tea.
Drinking tea.
Yeah.
No, but tea is not. I mean, what we do is we basically don't want to have post-surgery for the first day or so. You don't want the patient to have anything. Everything that is the patient has is room temperature cold. After that, you can have whatever you like. It's not a problem at all. Temperature becomes an issue only within the first couple of days, mainly for the wound to heal. It's, it's nothing to do with the implants.
Uh, and Vadraju KR asks, is it durable and what is the cost?
Well, cost will depend entirely on who you go to, I suppose. I mean, that's a very tough call for me to make as to what implants cost. It depends on the kind of treatment that's required, whether you require grafting, whether the number of implants, is a variety of things. So,
Uh, we have several questions that are just coming in. Uh, Ashok Oswal, he says, I'm 71 years old, male, and have lost total 4 teeth in the upper portion and one implant. One of them has gone bad due to infection. I have had a bypass surgery 4 years back and a total knee replacement on both knees about 8 months back. He hasn't asked a question, but this is his state of being. So I guess he needs advice on his teeth. He has lost total 4 teeth in the upper part, and one implant on one of them has gone bad due to an infection.
okay. So the thing is, first of all, from the point of view of redoing anything would depend entirely on his physical condition and his medical condition, whether he can undergo a procedure. That's number one. Second thing is when you talk about implants and implant failures, especially what he's alluding to, please understand me. If you look at the literature, there is a 2 and 3% chance of failures of implants with anybody who does it. The biggest clinicians in India, the biggest clinicians in the world. So the thing is, if someone says that they're doing implants and don't have failures, either they're not doing implants or you're not getting the right story. So yes, it's bad luck. I mean, that something's happened. It happens to us. It happens to everybody. The more the implants that you do, the chances that you will see failures at some point, without a doubt.
So Mr. Oswal has asked another question very quickly. He says, can I go for implants again or bridge to cover all the teeth, uh, two on each upper jaw?
Of course you can. There's not a problem at all. It's just that where the implant's been infected, you need to clean the bone out, take the old implant out, clean the bone, wait for everything to heal, go back in again and place your implants. That's all that you do. That's all. It's as simple as that.
We have a question from Devendra Gada, who says, which implants are good and how reasonable are implants? I know the questions are once again coming to the price,
Okay.
but if the gums are not there, then do you recommend the implant?
No, there are a variety of ways today of regenerating bone. I mean, in the upper jaw, you can go into sinus grafts, sinus procedures, where you fill your sinus with bone and then place implants to create the amount of bone that necessary for your implants. Having said that, I mean, it depends on the company. I can't tell you because there are maybe 120, 150 companies in the world that make implants and probably more now. But even in India, you probably have 30 or 40 companies. Most of them are fairly well made. So I don't anticipate that there should be any problem with any of them.
Bharat Samtani, who says, which country implants are considered the best?
Whatever I use. No, I'm just joking. No, it's they have implants from all companies. They're from Israel to to the European countries, to the Americas. I mean, they all have implant manufacturers. We don't have them in India as yet. The DRDO did something for a while. It wasn't quite successful, but that's about it. But having said that, the remaining that are coming into India, by and large, I think should be fairly good.
There are no cheap Chinese variants.
Sorry, not that I know of. And if there are, I wouldn't use them in any case.
Jokes apart, there is a question again from an anonymous attendee who says, you ask, is there a risk of running infection during the treatment of implants? Could you elaborate?
Yes, of course. I'll come to the points. If you're talking about failure of implants, sometimes implants can be completely without reason. I mean, most times you will say, oh, there was an infection, or most times you will turn around and say the bone was poor quality, all of that. Sometimes the bone can be of adequate quality, the procedure that you do is adequate, and you still have a failure for some reason. So that's one. Can there be an infection? The infection can occur at any time. It can occur at the time of the surgery. It can occur 3 months later. It can occur 3 years later at some point for a variety of reasons. But having said that, the percentage of that happening is probably 2 to 3%, as I said earlier.
We have a person who's asked a similar question to a doctor in the past. So hence it's a little funny that he asked, but it's a serious and a sensitive question. What is the hit rate for surgeries to go wrong? What has been your own experience?
I'm sorry, what is
the hit rate for surgeries to go wrong? What has been your own experience?
Well, the thing is, the only thing that can go wrong is the failure of an implant. I mean, if you're talking about hitting a nerve or hitting something else, as long as you have all your X-rays and everything and CBCTs in place, I mean, as I've said, so far so good. We have not had a problem with where that's concerned. Plain and simple. Failures with implants, of course, you can have. But if you're talking about hitting a nerve or something, you need to be careful. That's all.
Right. We have a question from Arun Virvani, who says his age is 73, 25 teeth I extracted. I don't mind the gap, but feel number 26 is also a little weak. Please suggest.
Yeah, you need to see an X-ray for that. A little difficult for me to comment about what's missing. And many of these teeth, what happens is if they are mobile, they remain in the mouth for a fairly long period of time, and they tend to lose bone as you go along. And the moment you lose the bone, there is insufficient bone to place implants. So unless you look at an X-ray, very difficult for me to actually opine as to whether the implants can be done or not.
Okay, we have another question from Surendra Sarup, who says, my name is Surendra Sarup. I'm 78 years old. I'm a vegetarian teetotaler. I had 15 teeth implanted done recently. I need to know what is an average life of an implant.
Can be a lifetime. We started practice in 91, and we have patients who have those implants in the mouth even now. So the thing is as long as our job of putting them right is done, and the patient's job of maintaining them is done, they should be a lifelong process.
Mahesh Chaudhary asks, what is the difference between basal and conventional implants?
Well, what we do is we basically use, I know what basal implants are, but by the same token, we use conventional implants. Basal implants are used very often when there's not sufficient bone available, but we use conventional implants. We don't use basal implants at all. Absolutely not.
Doctor, there's a question which is a very basic question, but what basic tooth and gum care hygiene is recommended to help maintain healthy teeth and gums? And not, there's another question which has come in, which is, what is the kind of care one can take? Can one be alerted in advance if you have a situation with your teeth which might happen at one's old age?
So the best thing, as you know, as the topic of this thing is, it's good to go to the dentist every 6 months, number one. Number two, you have various issues that come up with the oral cavity as age advances. We're all taking medications for a variety of things, and that medication can cause something called zetastomia. Zetastomia is basically dry mouth. The moment you have dry mouth, the saliva in your mouth acts as a lubricant and cleans the surface out completely. Whereas when you have a dry mouth, there's no saliva in the mouth, you tend to get caries, you tend to get a variety. So the best thing for these situations is, one, to go to your dentist, get a regular cleanup if that's possible. Number two is to turn on and use a fluoride toothpaste all the time, even get a fluoride guard, which a dentist can give you. Number three, to avoid, if you have a dry mouth, use water. Don't have drinks which have a high content of acidity or sugar. Even a simple can of Coke has 10 teaspoons of sugar. So, you need to just be careful with what you're having and maintain those teeth.
Uh, we have a question from Jitendra Vora. Uh, he says he has sent photographs via email, but I haven't been able to see them. But his question is that his upper middle teeth and gum, he has pain in them. What should he be doing?
Go to the dentist. Honestly, because the thing is, what happens is if you have the X-rays, what you can do is send them to your dentist. Let the dentist have a look, opine on them, and tell you what the reason for the pain could be. It may be an abscess that's developing, which he needs a root canal for, which sometimes needs to be done urgently so that you don't lose the tooth. It could just simply be something that he's been clenching on or biting on, which causing the pain and which needs to be attended to. But the X-rays are essential for these.
So we have a question which has come in from Arun Virmani, who says, "You're very good and kind too." But before that, his request is, how can I send you an X-ray of mine?
I think you have my contact, so whatever needs to be done.
All right. But clearly, I think the message is that, if you have an issue, you must go to your dentist, and we will, of
No,
course.
sorry. No, to sum it, without a doubt, the thing is, as long as you know that your dentist has the protocols, and I'm sure most of us are doing that, it's safe to do it. If it's something that can be put away for a while, and you think that for the next 2-3 months you can get by without it, please do that. Take some medication and everything. But if things get out of hand, I know it's apprehensive. All dentists are taking the precautions that are necessary because it's safety for everyone all around. So I'm sure it's not a problem for them to go to the dentist and get themselves checked.
We have a question from Krishnadas Shah, who says, "I have had implants and almost 11 years, and my age is 70 years. Uh, Irregular check with doctor, 4-month gap. What precaution required and longevity?"
As I said, if the implants have lasted 11 years, he's been looking after them. The job's been done well. He's looking after them well. So then it's a question of maybe if he goes for 4-month checkups, I know it's been 6 months now, maybe you want to turn on and take that plunge and go to the dentist and get yourself checked. Or if you feel that you don't, wait for another couple of months and get yourself checked.
Mr. Vora, I have got your question by mail, and I have got the pictures, which I will forward to Dr. Narvekar, and perhaps we'll email you the response. Uh, uh, Doctor, the question which is there once again is that, is it possible to take an X-ray of the entire teeth to get an advance info on what the state of the teeth is? This question is from a 65-year-old who says that, "I thought I had absolutely okay teeth, except when one started paining and I had to get root canal for 2 of my teeth, which was very expensive. Is it possible for me to go and get my teeth tested on a regular basis, just as I get my blood tested off and on?"
Yeah, so the thing is, my suggestion would be to go to the dentist rather than go to a radiologist. I'm not saying that the radiologists are the thing. You may want to just go to your dentist, because traditionally, if you look at it, we have also been able to manage infection very easily, is because the protocols that we had in place even before COVID. I mean, we maintained the same amount of strict hygiene protocols, which we still maintain, and of course have now upped because of the corona. But by the same token, it probably would be safer for him to just walk into the dentist's office, get himself checked, and make sure everything's fine, rather than just taking X-rays. One, you're radiating yourself, and number two, you're going to a radiologist, a third party, and then you would take that X-ray and go to your dentist, which really doesn't make sense. I would rather you go to the dentist and check, and any particular area that's bothering him could be X-rayed in the dentist's office itself.
So, Mr. Bharat Santani asks another question. He says, "No dentist gives us all the details and history of our teeth, which is locked up in his computer despite repeated requests."
For us, what we do is our X-rays are open. We make a copy for the patient, and the patient gets his X-rays on his email as soon as it's done, if they request it, if they want it. So, I mean, I'm sure most of them would probably give it to you if you ask for them. But if they don't, there's nothing that I can say, really, honestly.
But the question is that the point is that you can ask for your X-rays.
Of course you can. I mean, tomorrow, if a patient comes to me and wants a second opinion, saying, "Doc, you have told me exactly what treatment you need, but I want to make sure that it's the right opinion. They're certainly entitled to another opinion. Why shouldn't they be? Without a doubt, there's no question.
We have a question from Rajpal saying, how many teeth can be implanted at a time?
Well, you can technically do the whole mouth at one time because you don't really need to put one implant for every tooth that's missing. If you're missing all the upper teeth or all the lower teeth, anywhere between 6 and 8 implants is necessary to replace 14 teeth. So having said that, what you can turn on and do is literally do it as a surgical procedure where you place implants on the upper jaw at one visit. A week later, that's what the protocol that we follow in the clinic anyway. And a week later, we turn on and place the implants for the lower jaw. So within 2 surgical visits, all the implants are placed.
You answered a similar question in the past, but what extra care should be taken for bridge as compared to normal teeth?
If it's a bridge, it's just a question of flossing around the bridge, because if it's a bridge which is joining 3 teeth, you cannot floss in between them. You need to floss on either end of them. So the protocol for maintenance, whether it's floss or whether it's your brushing, remains the same.
One last question, 2 sets of questions. One is basically on tooth care and gum care, and the other is, doctor, what do you recommend we have as food which is not acidic, etc. This is the time for festivities, and one does have sweets and marzipan cakes and the like. Should one brush one teeth every time you have something sweet, or is it okay to just brush your teeth twice a day?
So if you're having this only during a festival time, I don't think having it for a week or so in a year is going to make any difference. Or if you have 3 festivals in a year, having it for 3 weeks in a year. It's somebody who's having it every day for 365 days. That's when the issue comes in. Number one, of course, and what he suggested about brushing, of course, you need to brush and keep it clean after you have that so that you enjoy the sweets and you turn on and take care of your teeth at the same time. But if you're doing it 3 days, 3 weeks in a year or 4 weeks in a year, I don't think it's going to make any difference at all. Absolutely none, as long as you clean it out.
At the end, doctor, it's been great. You answered questions, and so many of them which were around on similar issues. Uh, you know, just your overall tips on uh, care of the teeth and keeping your gums stronger. What is it, and especially for senior citizens, what would you? Is there some kind of a magic formula that the people should employ to ensure that they don't really have to go to their dentists, beyond the twice a year that you recommend?
See, the only question arises where senior citizens are concerned is whether they are ambulatory, in the sense whether they can actually get to the clinic. If they can get to the clinic, then the 6 month is really worth it, for the simple reason your dentist can take care of whatever you need, look after your teeth the way they're meant to be. If you are homebound, then the question comes up about maintenance, at which point, as I mentioned earlier, 2-3 things. Avoid things which have drinks or food which have a lot of acidity or a lot of sugar, because most patients, I mean, I'm 60 years old and I'm on a number of medications. So I'm sure people who are in the 80s and 90s would have a number of medications also. And along with that comes, as I mentioned, a big issue in all over the world is dry mouth. And with the dry mouth comes the issue of teeth not getting clean, developing caries, the plaque and calculus collection. So all these things can be, if you're ambulatory, get to the dentist, get yourself clean. If you can't, avoid as much as you can, stick to water as opposed to soft drinks. I mean, a can of Coke has 10 teaspoons of sugar. So you can imagine the damage it's doing to everything. So you need to turn on and be careful about that. And that's about it. I mean, it's regular maintenance. That's all, nothing else.
So, and what about the diet drink? Is it better than the
Drink is worse for your health than, I'm not talking about the teeth, but it's worse for your health rather than anything else. It's far worse, believe me, for your health than a regular Coke.
All right. Thank you, doctor, for answering all the questions very patiently. We've responded to most of the questions except for a few of them which have just come in. There's a suggestion and a request from Mr. Ramesh Asati, and there has been some questions, some requests earlier to have these sessions in Hindi. We will soon do a few sessions in Hindi once in a while for people who are not too comfortable with English. So we will do that. And thank you very much, Dr. Narvekar, for taking time off and responding to all the questions that we've had. Is there a way which we have a question which has come in? How can they teleconsult you?
So all that they can do is, I mean, if they can just send me an email, I can reply back on the email for them and take care of it if there are any questions. It's not a problem at all.
So, so a word to all our attendees here. We will on Monday have the edited video of this session put up on seniorstoday.in. You can visit that in the webinar section, and the edited video of this will be put up over there. We will also have the takeaways from the session put up over there, and you can read them. And we will also have an email where you can correspond with Dr. Narvekar directly, and then he would advise you on what the next steps are. Thank you once again, Dr. Narvekar, for being here. And thank you once again to all our attendees here. We will be back with another session of Health Live at Seniors Today next Saturday.
Thank you so much for having me here. Thank you.